Unfortunately, I think healthcare in the United States is broken, and I do know that primary care at Avance is different. It feels very patient-focused.
When I started 40 years ago, all doctors were practicing independent professionals. It was the patient and the doctor decide what was best. But then corporations and businesses started coming on board, and it turned more into a money-making machine.
You're so busy seeing volume. You have to see X amount of patients in order to get a certain overhead or in order to get a certain amount of reimbursement from insurance companies. And unfortunately, because of that, it oftentimes takes away from the time you get to spend with the patients.
You know, lifestyle's a troublesome thing with primary care. There's a lot of uncompensated hours with doing labs and documents and telephone calls and documentation that really burden the day for the physician.
I get to focus more on the primary care, and we have a support system that works as a team working together to take care of the patients.
What vaccines are needed this time? My nurse already checked on the reconciliation of the medications. My medical records team already asked for the record from the hospital.
I feel like there are a lot of systems in place at Avance Care to make it so that you can have a more efficient day when you're working.
What Avance does is it's already got the systems in place to make that, to gather that data, to have it there for the physician when they go to see the patient.
We have a very collaborative approach, so we have nutritionists in-house, we have behavioral wellness, our therapists, counseling, and we also have our pharmacists.
So having all these holistic approaches with the traditional medical practices and be able to offer those to patients with the advanced care support is just literally a dream coming true.
When you tell the patient, oh, well, our therapists are here in the same building, they're so relieved. They know where to park. They know how to get here. They already know the front staff. They're part of the family here.
And now with our innovative changes, we have phone apps, emails, portals, and they can chat with us, so it's easier for them to communicate with us.
I've had on numerous occasions patients say it was really nice to be able to see their lab results on their phone, or I could schedule my appointment on my iPhone or on my laptop. I wasn't feeling good and I got an appointment like that.
Avance Care definitely has a patient-first philosophy. They have designed our schedules, our offices, all for the convenience of the patients.
We're open Saturdays and Sundays for pre-scheduled appointments as well as acute care, which for most working adults or kids that are in school, and this is a wonderful option for them.
I really was just shocked that there was a organization that was marketing itself in a way that was to say that they were providing easier and more access to patients, but also simultaneously they were going to provide a work-life balance for physicians.
Work-life balance is something that I hold very dear, and I'm constantly preaching that to my patients and saying, okay, you need work-life balance. So I feel like it would be hypocritical if I didn't implement that in my life.
It happens because, we have extended hours, so we work 12-hour shifts, and we work 3 days and then 4 days the next week. So we have more days off to spend time with family.
Especially someone that has young kids at home, that's big, because that means doctor's visits and other types of things you can only get done during typical business hours. I don't have to take time off of work to do those things. It really gives us a lot of space in the schedule to be able to live life outside of working in Avance Care.
So because I have days off during the workday, it just allows me to do more sort of business-like things on my days off for other organizations. And
in my last job, that my life was basically work, recover, repeat, and I don't do that anymore. Actually, people have commented that they have never seen me look so relaxed and happy and actually have time to do things.
We decided that we wanted to look for a better place to raise our children. So we moved back down to North Carolina in the mid-80s, and we have never regretted that decision.
Things I love about the Triangle: the diversity, the culture, the food, the nature.
I also like that you can get close to the beach, you can get close to the mountains, you can find a theater, you can find a sporting event.
That excitement, that stimulation of a city with lots of good restaurants, lots of things to do, but it doesn't feel overwhelming.
One of the things I love most about being an owner of an Avance Care clinic is that when I have an idea, I just have to reach out to the people that support me and they make it happen. If I have a software issue, it gets fixed. If I want to start a specialty clinic, like there have been so many things that I wanted to do at my last practice and I didn't have anybody to help me do it, and I'm too busy to do it. I needed that kind of support.
You can have all the greatest idea to open your own clinic, but if you don't have the administrative support, and if you don't have the management, the building, and everything that comes along with that, the chances of you being successful are not as big as if you're having a good team who are working with you.
So as a nurse practitioner who's practiced for 25 years in this area in a variety of settings, I have to say that the Advanced Care model is the best setting I've ever worked under.
So I would recommend Advanced Care because it feels like a family and you feel like you can practice medicine the way you want to practice it, the way that it was intended to be practiced. What made all of us want to get into it in the first place, you're allowed that freedom to practice and focus on the patients in a supportive and collaborative environment.